All right, everyone. Thank you so much for helping. My name is Ransom Nyema. If you're meeting me for the first time, my name is Ransom Nyema. Like I said before, I'm a medical student studying radiography, and I'm also a medical content writer. And if you're a returning subscriber, thank you so much for coming in. So today we have an amazing section for you. Um, Another med talk with an amazing personality. Tanvi, could you introduce yourself to the audience?
Yes, thank you, Ransom, and thank you so much for inviting me. I'm not so amazing as Ransom described, so just giving you a brief introduction of myself. So, my name is Tanvi Kasture, and I'm from India originally. I've just come to UK 2 years ago to do my master's in public health. So before that, I did my medical training in India in homeopathic medicine. So for those of you who don't know, it's a system of alternative medicine in India, which is quite famous and well practiced. And we are basically qualified physicians, but we have to prescribe homeopathic medicines and only the basic allopathic or the modern medicines, like we say. So as soon as I completed my undergrad and I had a little bit of clinical experience, I decided to pursue my master's in public health. And that's where I shifted to Sheffield, UK, and I completed my master's there. Currently, I'm working as a GP assistant at a NHS center. So what I do is do basic clinical tasks, administrative tasks to assist the GPs so their practice can function well. I'm also a little bit into the management side, so doing little tasks like audits and everything. It's a bit complicated, but it's quite fun. At the same time, I'm also doing healthcare article writing internship at Clarity, and I just now wrapped up a model WHO conference in London, so I was part of the organizing committee. So this is briefly about me. Yeah.
Amazing, amazing intro. Thank you so much for introducing yourself, Tanvi. We so you have a lot of questions for you to answer. Are you
Okay.
ready?
Yeah, sure. Bring it on. Yeah.
All right. Before I ask you this questions mapped out for you, you know, I know that studying medicine in India is a very good thing to do,
Mhm.
right? So tell us what made you to make that transition to do your masters in the UK.
Yeah, so starting with what homeopathic medicine is, it is basically a holistic healthcare system where you get to treat the person as a whole, not just the disease. So we pay importance to the mental, physical, and emotional well-being of an individual. During the COVID time, as many of you may know, all of the countries struggled with their healthcare systems, and we realized that our public health response is lacking in some places. So, when I was in my final year, so I was doing my clinical rotations. As you can imagine, after completing just 4 years of, textbook learning, you're put into the field and you're expected to handle an epidemic. So I was put in charge of, let's say, around 80 to 100 patients every day. I used to take care of them, just the basic medicines to check their vitals, and then report it to my superior. But that's when I realized how much of our healthcare infrastructure is lacking, and we need to improve on public health, and that's how we will be at large able to affect the communities and improve the healthcare system. So that's what fascinated me towards the public health, and I started reading more about it. I started to understand it's not just epidemiology that we were taught in the undergrad. It goes way beyond that. So it's also about policy making, it's about research, it's about administration, it's about projects. So there's a lot to discover. And when I got to know about that, I got more interested. Um, so that's how I chose public health. Now, I also decided to do whether in India or should I choose to do abroad. So that always played on my mind. And I chose to do abroad because I wanted to gain more practical skills and I wanted to learn from a global perspective. So that's when I chose UK, because United Kingdom has high quality education and I could learn from global perspectives. So the professors come from various backgrounds, which is somewhat lacking in India, except at the top medical institutions. But we pretty much have our own people teach us, so we are limited by the understanding in a more global sphere, I would say. Um, Another thing why I chose UK was because it has high reputation. So if I do a degree from a UK university, I know it will be accepted globally. And like I mentioned before, I think I would like to be a global citizen. By that I mean I don't want my knowledge to be limited by borders. I want to interact with people coming in from different perspectives, different cultures, and I want to help out not only my own people but everyone that I can, and that's sort of like my dream. So I do want to travel the world and try to help out people in any way that I can. So that's the reason why I chose UK, because I know that's one degree that will kind of put me at the forefront when I get to or apply to such positions. So that's when UK comes in. And as for my university, so I studied at the University of Sheffield. Um, it's it's a really well-known university. At that time, it was the top 100 universities in the world. Um, it's also the program is accredited by APHEA, so it's a European body for accrediting public health courses. That was one thing that I noticed, but mainly the thing that attracted me were the modules. So the modules were a mixture of public health and management science. So my course was a master's in public health with specialization in management and leadership. So that was a unique blend that the course provided. So in the first semester, we had epidemiology, we had um, key issues in global health. We also had health needs assessment and evaluation. We had introduction to research methods. So these are all the core subjects. And the second semester, we had subjects related to policy making. We had subjects related to health economics and leadership and management. So I had like this unique blend that only this university could provide. So that's how I narrowed down. So that's completely my transition. So from being from medical student, being interested in public health, and then choosing abroad, then UK, and then University of Sheffield. Yeah.
Amazing, amazing, Tanvi. Thank you so much for sharing that with us. It's great. It's great to know your that transition really helped you. So, what are you gonna bring back home? You know, your country. What are you gonna bring back home? Do you have any plans for bringing back home some, practicalized public
Yes.
health? Are you
Yes.
planning to do that?
Yeah, definitely. I have learned a great deal from here. It's not just the education, it's the people I was with. So I studied with one of the best um, course mates from all over the globe, and they introduced me to their healthcare systems. I was not aware of it. So in India, we have a completely different system where most of our healthcare is out of pocket expenditure. But for example, in UK, we have NHS, which is fully funded by government. So this is something that I was not aware of when I was in India. And many countries, like I had a lot of African course mates who had come from Africa, and they told me their perspectives, and I could see the similarities and I could see what they were doing better, which we could implement. I could see what NHS system was lacking. and what their plus points and the cons. So I think what I can bring back to India is this diverse perspective, um, not only through the academic curriculum, but also through the in person conversations that I had with a lot of amazing people. And I'm sure that collaborating with them, bringing their unique knowledge into Indian setting would definitely be helpful. Yeah.
Amazing. Thank you so much. So you wow, that was an amazing story you shared there. Thank you so much for sharing that. By the way, so we have some questions, like I said before. Um, so I'm going to ask you the first question right now. So if I'm looking downwards, I'm reading the questions to Tanvi. All right. So you've been wondering what am I looking downwards for? That's a little disclaimer out there. All right. So the first question goes this way: how did your training in homeopathic medicine in India influence your views on health, especially when you moved to the UK to study masters in public health? I think you've shared some insights in this, but could you extend further?
Yeah, so like I mentioned before, homeopathy brings in holistic healing perspective, which is that we don't heal the disease. We are not looking at the disease. We are looking at the human behind the disease. So when we look at health, we should not only see that, okay, this person maybe has something, let's say maybe he has diabetes. So it has something to do with his pancreas not secreting enough insulin. So we directly jump into, okay, pancreas, insulin. So we give something related to the insulin production. So this is how we usually view health. But in homeopathy, what we view is what is causing this trouble. So we see, is it related to the genetics? We see, is it related to the stress issues? Other than the cause, what is maintaining this disease? So we, how much ever we try to give orally medicines to maybe balance this insulin flow, we need to see, like maybe modify their lifestyle changes. We need to see if there is any mental stress that's harboring and causing decline in their condition. So this holistic view actually helps in the overall well-being of an individual, not just treating, oh, this is a case of um, type 2 diabetes. We treated, oh, we are treating Mr. XYZ. We are not treating just the type 2 diabetes. So I think this is what the viewpoint of health is. And in UK, this is pretty much appreciated. Um, this is looked after. The mental well-being of individuals is given importance. Back in India, this is a well-known fact that mental and physical health is related, but we tend to place more importance on the physical health, and a lot of people hesitate to reach out when they want to discuss any mental health issues. But in UK, I've seen people are a bit more free. They are not prejudiced or biased, or there's no stigma, I would say, for mental health. So people are more willing to discuss these issues openly. The only problem is because of the long waiting lists of NHS, it becomes difficult to access these healthcare services quickly. But the provision is definitely made, and there are various types of mental health support that you can seek. So at various levels. So I think that is a good structure base. So this is something related to the traditional medicine like homeopathy, and views on health. I hope that clarifies it a bit.
And I love the fact that you mentioned what you studied in India is really appreciated in the UK, which is amazing, which is really amazing. So, so you mentioned about um, the views you've had, on the UK healthcare system in terms of your course you studied in India. So right now, you work with the NHS, and I've been seeing a lot of you know shutdowns with junior doctors and senior doctors over there, and people going on strike, something like that. So, in your own perspective, before I move to the second question, what is the healthcare situation in the UK right now?
I think the system is very idealistic, but when you try to pan it out in a more practical way, if you're trying to put something so idealistic out, you need to have the resources to support that idealistic system. So I might not be the expert in this, but from what I've personally seen is the major cause or the major drawback right now NHS is facing is the waiting lists. So even if you have quality care available, you won't be able to reach the quality care on time. So there's no use of it if you don't get the care that you get immediately. In India, if we have any problem whatsoever, we can directly go to the specialist. But over here, we have to go through the GP. So sometimes getting an appointment of GP takes 1 or 2 weeks or even longer. After that, referring to specialists, I've seen cases get delayed by months. So, unless they don't treat it as an emergency, your case won't be fast track and you are expected to live with it for a long period of time. And I feel even though you get to speak with one of the best physicians or doctors, there's no use of it if you have to suffer for weeks and then you go to them. So this is my viewpoint, and like you mentioned, the junior doctor strike, I do support that in a way that everyone deserves to be paid fairly for the amount of work they put in, and with the kind of work that healthcare professionals, it's not just doctors, it's the nursing team, it's the healthcare workers and everyone else involved in a healthcare system, they do deserve to get paid fairly for the amount of work they do, especially when our healthcare system is so overburdened. You have to work overtime, and if you're not compensated for that, it is not really an ideal environment to work in. And that somehow also affects the performance. If you're not happy working in an environment, it reflects in your performance. And as doctors or medical professionals, if it affects our performance, it affects the communities. So yeah, that is my perspective.
Wow, thank you so much for sharing that with us, Tanvi. Um, wow, you work with the NHS. So, what is the NHS doing about this strikes and whatever is happening with the junior doctors and amongst the healthcare professionals and the UK? So, in your narratives, could you just share what the NHS is planning to do or what they are doing beneath, in workings with what is really happening in the UK?
I believe they are trying to get to the root cause of it. I've been hearing about management reports where outside consultants are coming in and trying to figure out where we can um, allocate our resources more efficiently. But it is a system where they don't openly share what the management is thinking. So it might take some time for them to clearly communicate with NHS workers what they are planning to do. There are lots of controversies going on, but um, it's a so the management decisions of NHS, they are not very open with it, I feel. So we will get to know it later. I don't, or maybe I'm not so sure about what they are thinking right now. Yeah.
Thank you. So, I have another question for you. So, before I ask you that question, what dragged your interest with global health? Tell us.
Like I mentioned, so I actually was initially interested in public health, And when I came to the UK, I took this module related to key issues in global health, and where we discussed various issues and from various perspectives of different countries. So, if there is a particular disease, how each of the countries responding to that disease or that epidemic. It was really interesting to see the difference in levels of response, not only levels of response, the root causes, the resources. If one country A is having more resources, but it is not able to deal because it does not have enough healthcare workers, whereas country B does have enough healthcare workers, but it's the public which who are not getting educated enough. So I really found this difference of in response from each country, the different kinds of problem each country is facing, and how collectively the countries can help each other in solving these issues. So that is what sparked my interest. Another thing, like I mentioned, so I had discussions with my course mates, um, who are basically my colleagues. So they are from different countries, and listening to their perspectives, I feel that global health is not based on what each country's representative thinks is best for their country. It's more of a collaborative effort. Another thing that really interested me in global health is, and I think this is the key factor now that I'm thinking. So we had model WHO conferences. In Sheffield, we have Shefhu, and in London, we have Lunhu. So in these conferences, um, the participating members, who are the delegates of the conference, they get to represent a particular member state. Member states are countries of WHO, so they can represent a member state or a non-state actors, which are NGOs or other organizations or pharmaceutical companies, industries. And then there is another aspect of media coming into the role. So it is basically a simulation process where we have to enact about the World Health Assembly. And I participated in it. I was representing Germany, and that was my first time when I had to step out of my comfort zone and talk about or represent a country whom I haven't have experience in. So yeah, it was really unique, where you have to leave aside your personal biases and opinions and actually represent the country and do justice to the country. So in that, I think it sparked my interest, because the way we had to work was collaborate with other member states, form alliances, and then build a resolution to solve a particular health issue. So our um, area of focus was migrant health. And in that, I formed alliances with other member state countries, and we essentially talked about, for improving migrant health, we need to build a culturally competent workforce. So that was the topic of our resolution. And what we did was, the countries that Germany receives more migrants from, to collaborate with those countries and maybe have some training given by their country's workforce to our country's, Germany's workforce, and try to build a more culturally sensitive environment. And that really sparked my interest. Like, it's not just about strengthening your own country's infrastructure or your country's needs, demands. It's also seeing how we as a world or globe, building together a better future, a more sustainable future for for us and the future generations. So this is, my point of view is very idealistic, but this is what sparked my interest in global health. Yeah.
Amazing, amazing, amazing. Wow, man, you have a lot doing on your table, and I really loved your tenacity in terms of the healthcare in general, and you're gonna do amazing stuff in the future. Making, especially back home in India, making the healthcare system more stabilized, for the citizens. And so kudos to what you're doing. So that draws me to the question. So as a global health enthusiastic, right? How do you see the intersection of traditional medicine such as, homeopathy, with modern culture? So in a nutshell, tell us what that means.
Yes, so I think your question is how do you integrate homeopathy or other traditional medicines with modern medicines to make a better healthcare system? Um, I feel that traditional systems, not just homeopathy, so in India we have Ayurveda, we have Unani, we have Siddha, so we have all these traditional healthcare systems coming together. We also have a Ministry of Health that is Ayush. So it's a Ministry of Health which looks after the alternative systems of medicine, and homeopathy is one part of the alternative system. The way I see it is traditional systems offer a more culturally diverse perspective. Traditional healers are known to have a good connection with the community since they are the ones who are whose beliefs or traditions are rooted within the community. So, like for example, in Ayurveda, it is the oldest medicine system in India and one of the oldest in the world. So, it is very respected and it stems from Hinduism and um, Indian traditional past. So it is very connected with the people, and when people speak about it, they are able to relate to it better. So I feel people or Ayurvedic doctors, they are able to connect with people more and people are able to trust them more. So I think it is really important because it builds resilience within communities if you have traditional systems integrated with modern medicine. Another thing that I've noticed in India is it reduces the workload from the modern doctors, like we mentioned in NHS about the workload. And one of the things why India we can directly access the specialists is because the normal cases, the not so severe cases, they are handled by the GPs as well as the traditional healers. So if you have a cold, you don't have to go directly to a modern medicine practitioner. You can go to traditional healers and take the medicines that you have been taking since childhood, and they are qualified doctors, so they are not going to misdiagnose you. They have received the same training like the medical professionals, the GPs have. It's just they are providing you with other medicines. So I feel it has reduced the burden on our Indian healthcare workforce a lot. For example, many of the junior doctors in India, we have students like me. So I used to also practice allopathic medicine, that is the modern medicine, when I was in my clinical rotations. I was not legally allowed to prescribe it, but I can do the same thing that I'm doing right now. Do the basic clinical tasks, think about ordering some lab tests for the individual, and then present a summary to my senior doctor, who will then be able to prescribe medicine. So the senior doctor can see 10 patients instead of just one patient, with the time saved by alternative medicine practitioners such as me. So that has helped quite a lot. Um, Another thing I would say, I think these are the two main things: reducing the workload and building a more culturally significant healthcare system. Yeah.
Thank you so much for sharing that with us. So, in a nutshell, I noticed that public health has a lot of researchers and projects, beneath it. So tell us, can you share some public health researches or projects that you are really, really passionate about? So tell us.
Um, I haven't had personal experience in being involved in public health projects, but I have heard of a few which I would like to share. So there is a project in Zimbabwe that I've heard of. I'm not sure if you have heard of it, but it is quite famous because of the results it has been able to achieve. The first one is about friendship bench projects. It is where the lay people in the community, specifically the grandmothers, are trained by qualified professionals to give evidence based talking therapy to individuals suffering from mental health disorders such as anxiety, depression. So, friendship bench is like essentially a bench in a park where people can just go sit, relax, and speak with the grandmothers, and they might give some life advice or they can just listen to you. So this has helped significantly reduce the mental workload and burden on the community. And coming, like I mentioned, the importance of community based involvement in public health projects. This is a perfect example where they have utilized someone who is not into the healthcare workforce but can contribute to healing within the community. So this is one project that is exceptional, and I feel it can be applied everywhere in the world. It can be applied in India. We have um, India and UK, where we have grandmothers or adults over 70 years of age who want to speak to someone who are facing loneliness. And if we just connect them with people who are seeking this sort of support within the community, we can improve the mental health care of people without having a long waiting period to see a psychologist or a psychiatrist. So this is one thing we can mitigate the mental health burden. Um,
Amazing.
another another project that I was involved in during my master's year. So we did two projects related to the mental health care of university students, where we discussed and built a tool or designed a tool in helping students navigate their transition from their undergraduate life to the university life. We also did another project to see about the inclusivity of students, especially is inclusive and diverse. So, yeah.
I think we had an internet disconnection, but hopefully we're
Okay.
back right now.
Yes.
So we have the last question for you. Are you ready for the last question?
Yeah, sure.
So, in a nutshell, right? What problems do you see in integrating automatic or um, you know, automatic or automatic? Did you understand that? Automatic. Did you
Yeah.
understand it?
Yeah.
Okay. What problems do you see in integrating automatic medicine, such as your field, homeopathy, into mainstream medical system in general? So tell us how the problems in integrating, your course with the mainstreams of the medical system in general. So in a nutshell, please tell us.
Yes, that's a great question. So, like I mentioned before, I only told about the benefits, but we have to be careful about the limitations and the problems that we might face. Um, I think first main reason is lack of scientific evidence. It is a very important factor because most of the traditional medicines do not have a very well established scientific base, such as they don't have large scale or well designed clinical trials to show the efficacy and safety of the medicines, whereas modern medicines, they have elaborate trials to show why this medicine works and how this medicine works. So, this lack of scientific evidence might cause some hesitancy in um, integrating it with modern medicine. So, traditional medicines can complement, but they cannot replace the modern medicines. This is the most important point that we have to bear in mind. Maybe if we invest in or develop more research methodologies to try these alternative medicines out and then invest in integrating them with the modern medicine, it would be more useful. But at present, there is very few scientific evidence. Homeopathy is often termed as a placebo treatment. And the reason behind this is there is very few trials that have shown how homeopathic medicine works. And just based on few trials, you cannot conclude that homeopathic medicines are the best or they can be a good alternative. So I think that is one of the things. Second is the standardization of medicines. Modern medicines go through many regulatory processes, um, very rigorous regulatory processes, but alternative medicines, either the regulatory bodies are too lax or they do not take into account the seriousness with which we should regulate not only the medicines but also the healthcare professionals. Um, Modern medicine, like in UK, the GPs have to go through 7 to 8 years of training to be able to practice. But the homeopathic practitioners in UK, they do not have to go through any such rigorous process. So I think standardization here is very important. And keeping in mind these two things, the third most important thing is ethical consideration. We need to understand as healthcare professionals the line or the boundary which we have to draw between modern medicine and alternative medicine. Serious cases or life threatening emergency conditions should not be dealt with the alternative or traditional medicines. They do require immediate treatment or modern medicine, which has more scientific base and regulatory mechanisms in place. So I think if all of these problems or hurdles are sorted out in the future, it can be integrated with the healthcare system.
Amazing, amazing. So we've come to the end of the session. Thank you so much, Tanvi, for helping on as a guest speaker and for sharing your own narratives and expertise on these questions for the audience to get more clarity and enlightenment. I believe that the audience are enlightened by now. I know, because you shared a lot, a lot already. So before we wrap up the session, what are your last words for the audience?
I would just like to say if anyone wants to connect and discuss more about this, I'm always willing to. I am still a lifelong learner. I am not an expert in anything, so I've just provided my opinions. And if you feel that I have maybe lacking some knowledge in some part, I always welcome helping me out with whatever you think is right. So I'm open to just collaborating. Like I mentioned, I've learned a lot from my colleagues, and I'm sure when I connect with your audience, Ransom, that I will be able to connect with gem of people. So yeah, looking forward to that.
So if you love this content, do well to subscribe, like, and comment, and share to your network. Thank you so much, Stavi.
Thank you, Ransom, for this opportunity.
All right, you take care.
Take care. Bye.